الرحيم. معكم الأستاذ الدكتور محمد أحمد بابشموس، أستاذ الأمراض الباطنية والسكر والغدد الصماء، جامعة صنعاء. إن شاء الله اليوم نتكلم على approach to Rheumatological Diseases. في البداية when the patient presenting with musculoskeletal pain, you have first to differentiate whether it is an articular, and the pain arises from the joint, or non-articular pain, a pain that arises from the surrounding structure like the bursa, or tendon, or ligament, or bone, or from the muscle. If the pain occurs in both active and passive movement, it's an articular. If the pain occurs only in active movement, it is a non-articular. If the patient has a tenderness in the joint, this is articular. If the patient has a tenderness around the joint, this is non-articular. If the patient has a joint swelling, or deformity, or crepitation, or limitation, or crepitus, and limitation of movement of the joint, this is an articular. If it is not present, this is non-articular. A non-articular pain, زي ما قلنا, may arise from the tendon, or from the ligament, or from the bursa, or from the bone, or from the muscle. If the patient has an articular pain, you have to differentiate whether it is inflammatory or it is mechanical. This is from the history. Inflammatory or mechanical. Inflammatory arthritis could be monoarthritis or oligo or polyarthritis, while the mechanical arthritis, the most common of which is osteoarthritis. Also, it is the most common type of arthritis actually is the osteoarthritis, but it is mechanical in nature. Other cause of mechanical arthritis, including the acromegaly, the patient with the Charcot joint, or called the somewhat painless arthropathy, or hemoarthrosis. So you have to differentiate whether the patient has inflammatory or mechanical arthritis. You have to ask about the pain. The pain occurs at rest and it is relieved by movement, this is inflammatory. The pain that occurs in movement and relieved by rest, this is mechanical. If the patient has a prolonged morning stiffness, your base said to you that my joints is stiff in the early morning, I cannot flex my joints, which may last up to 1 hour. This is called prolonged morning stiff. This comes with inflammatory arthritis. If there is no morning stiffness or just a mild, this is with mechanical arthritis. If the patient has a cardinal symptom of inflammation, including hotness, or redness, with tenderness, with swelling, with limitation of movement, this is with inflammatory arthritis. If there is no cardinal symptom of inflammation, this is a mechanical. If the patient has a systemic symptom and sign, the patient has a fever, has arthralgia, has weight loss, has loss of appetite, this is go with inflammatory arthritis. If there is no systemic symptom and sign, this is go with mechanical arthritis. If the patient has waxing and waning, remission and relapse, this comes with inflammatory arthritis. Why there is a remission and relapse? Because most inflammatory arthritis is an autoimmune disease, and the autoimmune disease runs in remission and relapse in course, while the mechanical arthritis there is no remission and relapse. The only thing to do is you have to take a sample for CBC and CRB. If it is elevated, this is inflammatory arthritis. If it is normal, this is a mechanical arthritis. Okay, so I am differentiating whether it is inflammatory or mechanical arthritis. If it is inflammatory, you have to take a proper history. This is including the onset, the course, and the duration. According to the duration, we can classify inflammatory arthritis into two types. Acute if it is less than 6 weeks duration, and chronic if it is more than 6 weeks duration. If the patient has a complaint which is less than 6 weeks duration, this is acute inflammatory arthritis. More than 6 weeks duration, this is a chronic inflammatory arthritis. This is one. Onset, course, duration. The second, you have to ask about the number of the joint affected. If it is only one joint, this is called monoarthritis. If it is about 3 joints, this is called oligoarthritis. If it is more than 4, this is called polyarthritis. The number of joint involved. You have to ask about symmetry. Is it symmetrical and bilateral? If the arthritis is symmetrical and bilateral, this goes with, most probably, with the seropositive arthritis. If it is asymmetrical, this goes mainly with the seronegative arthritis. You have to ask about which joint are involved. Is it the small joint more than the large joint, or the large more than the small joint? If the small joint are involved more than the large, this goes with the seropositive arthritis. If the large joint are involved more than the small joint, this goes with the seronegative arthritis. You have to ask about which limb are affected. The lower limb are involved more than the upper limb, so it is seronegative. The upper limb more involved than the lower limb, it is a seropositive arthritis. You have to ask about whether it is migratory or constant. A migratory arthritis goes with acute rheumatic fever, gonococcal arthritis, seronegative arthritis. This is a migratory. Systemic lupus also, it's a migratory arthritis. You have to ask about whether there is a deformity or not. The most common type of arthritis which have a very characteristic deformity is the rheumatoid arthritis. You have to ask about the spine. Is the cervical spine involved more than the lumbar spine, or the reverse? If the cervical spine is involved more than the lumbar, this is a seropositive. If the lumbar spine is involved, this is a seronegative arthritis. Okay? This is the history. So the first type of arthritis, as we said, it's classified according to the duration into acute if it is less than 6 weeks duration, and chronic if it is more than 6 weeks duration. Acute according to the number mono and oligo and polyarthritis. So we have to start with the acute monoarthritis. Acute monoarthritis are classified into 3 types. If it is first attack, patient comes to you complaining of first attack of acute inflammatory monoarthritis. This should be diagnosed as a septic arthritis until proved other. نشخصها, it should be diagnosed as septic arthritis until proved other. If the patient has a migratory arthritis, we have 2 types, which is very important. Acute monoarthritis, migratory in nature. Either it's acute rheumatic fever or gonococcal arthritis. If it is episodic, what do I mean by episodic? It is an acute monoarthritis which have episodic attack. There is an interval period. This period is called intercritical period. This period may last us from months to years between the attack. This is episode. If the patient has acute episodic monoarthritis, you have to consider crystal arthropathy. طبعا أشهر الكريستال arthritis is the acute gout. Okay, so if we start to explain how to speak about the septic arthritis by definition it's an acute inflammatory monoarthritis. It affects mainly the lower joints. The most commonly joint involved is the knee joint. It may be followed by other lower joints, the ankle or hip joints and other joints. The small joints may be involved in a patient with rheumatoid arthritis or in a patient who are immunocompromised. يعني he has some immunosuppressive or he takes some immunosuppressive drugs, or he has some disease that causes immunosuppression. يبقى septic arthritis mainly affects the lower joint, but the small joint may be involved in a patient with rheumatoid arthritis who have a deformed joint, or in a patient who is immunocompromised. Septic arthritis غالبا is caused by bacterial infection. Most common is the staph. It could be also caused by viral infection, by fungal infection, or by tuberculosis. The most commonly affected joint, as we say, is the knee joint. There is a systemic symptom with local symptoms. Systemic symptom عادة there is a fever and rigor and sweating and the patient looks very ill and toxic. Local, there is a cardinal symptom of inflammation, including your hotness or redness or tenderness and limitation of movement. Septic arthritis is diagnosed by CBC. There is a leukocytosis with increasing mainly in the neutrophil. You have to do joint aspiration in order to do a culture sensitivity to know the organism and the specific antibiotic for it. You have to do also X-ray for the affected joint or other scan, and the treatment by antibiotic you have to start with vancomycin or cephalosporin. Then you have to choose antibiotic according to the result of the culture and sensitivity. The second type is, as we said, of the acute monoarthritis is the migratory. And the migratory, there are two types of migratory arthritis. The first one is called acute rheumatic fever, and the second one is the gonococcal arthritis. Acute rheumatic fever, if you want to diagnose an acute rheumatic fever, I will say that it is acute, yes? Why it is acute? Because it is less than 6 weeks duration, so it's acute in onset. Inflammatory, why it's inflammatory? Because of the presence of all cardinal symptoms of inflammation. Monoarthritis, because it starts just on one joint and spread to involve the other joint. Acute inflammatory monoarthritis. It is asymmetrical in nature. It involves the large joint more than the small joint, and it affects the lower limb more than the upper limb. The joint of the lower limb are involved more than the joint of the upper limb. It's migratory in nature, and it spreads from one joint to the other, and it leaves the joint without any deformity, and it has a characteristic response to aspirin. This is the acute rheumatic fever by definition. Like, and how to diagnose acute rheumatic fever? They say the Jones criteria or modified Jones criteria for diagnosis of acute rheumatic fever. There are 5 major criteria, including carditis and polyarthritis and Sydenham's chorea, subcutaneous nodule, and erythema marginatum. And the minor criteria including fever with polyarthralgia and increasing ESR and CRB, and prolonged VR interval in the ECG, plus a previous evidence of the throat infection with group A beta hemolytic streptococci. This is detected by increasing anti-streptolysin O or by other the anti-hyaluronidase antibody or by culture of the throat that yields group A beta hemolytic streptococci. How it is diagnosed? There should be at least 2 major criteria, or 1 major and 2 minor criteria, plus there is a previous evidence of infection of the throat with group A beta hemolytic streptococci. زي ما قلنا there is increasing ASO أو اللي هو الأنتي hyaluronidase antibody أو اللي هو culture of the throat. Okay. يبقى this is acute rheumatic fever. We go to the gonococcal arthritis. It is called arthritis tenosynovitis urethritis syndrome. يبقى arthritis tenosynovitis and urethritis syndrome. It's a female patient who has a past history of urethritis. She came to you after a period of 2 to 4 weeks. Why it is 2 to 4 weeks? This is the time for the auto-antibody to develop. So it's an autoimmune disease or immune-mediated disease. The patient comes to you complaining of اللي هو acute inflammatory monoarthritis. It's migratory, asymmetrical, lower limb more than the upper limb, and it is اللي هو spread to involve the other joints, usually asymmetrical. 10% there is asymmetrical arthritis. يبقى there is arthritis, tenosynovitis, there is inflammation of the tendon sheath, particularly the Achilles tendon, the lower limb, and urethritis, the patient complaining of urethral discharge. The third type of the acute inflammatory monoarthritis is gout, acute gout. So how acute gout is defined? Acute gout is defined as an acute inflammatory monoarthritis caused by deposition of monosodium urate crystal in the synovium of the joints. Usually the patient has a risk for developing hyperuricemia. This risk including age. Usually it occurs after puberty. The serum uric acid level starts to be elevated after puberty in male and after menopause in female. So acute gout is more common in male than in female before menopause. يبقى دي age and sex. Obesity, metabolic syndrome. You know what's the metabolic syndrome? Obesity now is a common disease. It is one of the most serious diseases that accounts for the majority of the common disease nowadays. Obesity is a risk factor for diabetes. Obesity is a risk factor for hypertension. Obesity is a risk factor for ischemic heart disease. Obesity is a risk factor for dyslipidemia, for hyperuricemia and gout. It's a risk factor for polycystic ovary. It's a risk factor for ischemic heart disease and heart failure. It's a risk factor for many medical complications. عشان كده سيدنا محمد عليه الصلاة والسلام رأى رجل عظيم البطن فأشار بإصبعه إلى بطنه قائلا ما هذا يا هذا لو كان هذا في غير هذا لكان خير لك. يبقى metabolic syndrome is the very serious disease, and the major risk for metabolic syndrome is central obesity. عشان كده سيدنا محمد أشار to his abdomen, central obesity, not generalized obesity, it's a central. Okay, so the serum uric acid starts to elevated because of age, start to be elevated because of high protein diet, start to be elevated because of alcohol intake, because of the drugs زي الأسبرين أو low dose of thiazide, start to be elevated because of hypertension, because of metabolic syndrome, because of some source of renal impairment, because of the increased production of uric acid. So the patient has a hyperuricemia, which may be totally asymptomatic. This period is called asymptomatic hyperuricemia. You may find a lot of the patient, their serum uric acid is elevated, but they do not complain of any symptom and sign. This is called asymptomatic hyperuricemia, and the patient may have no symptom and sign. When their solubility of the monosodium urate is increased, or there is increased nucleation of monosodium urate crystal, or increasing growth of monosodium urate crystal, so it gets deposited in the synovium of the joint. It causes activation of the neutrophil. Neutrophil will release cytokinase and granule that cause inflammation of the synovium, and your patient will come to you complaining of acute synovitis. It is an acute inflammatory monoarthritis. The most commonly involved joint is the metatarso-pharyngeal joint of the big two, so it's called podagra. What's podagra? It is an inflammation of the metatarso-pharyngeal joint of the big two. This is the most common presentation. It accounts for about 70%. The patient may also present with acute inflammatory monoarthritis of other large joints, including the knee joint and the hip joints, our elbow, our other large joints. The patient with a progression of the disease, but first is asymptomatic phase. This is followed by symptoms because of deposition of monosodium urate. Then there is a phase between the symptoms and the other attack. This phase is called intercritical phase. In the intercritical phase, the patient is completely free. So why we say that the gout is an episodic? It's an acute inflammatory episodic monoarthritis. Each episode may last us between about months or even a year. يعني ممكن المريض يكون totally free for up to months or up to 1 year, and the second episode will develop. This period between each episode is called intercritical phase. The second episode may be precipitated by certain precipitating factor. مريض خد a high protein intake, patient take a high alcohol, patient takes certain drugs, patient exposed to trauma, patient exposed to severe stress, patient exposed to ischemic heart disease. So he will develop other acute attack of gout. With repeated attack of gout, the monosodium urate will form a granuloma transformation, and the patient will enter into the last phase, the fourth phase, which is in the form of chronic inflammatory polyarthritis with tophaceous formation. The tophi may get deposition in the skin or in the finger. It may get deposited in the nail, in the pinna of the ear. It may get deposited in the interstitium of the kidney, and the patient also have a urate renal stool. This is clinically. لكن what is the criteria for diagnosis? طبعا the American College of Rheumatology will put a criteria for diagnosis of acute gout. They should be either a presence of the monosodium urate crystals in the synovium of the joint by joint aspiration. This characteristic monosodium urate crystal, it is a needle-shaped crystal. It has a negative birefringent under a polarized microscopy. If this crystal are present in the synovium of the joint, this is enough for diagnosis of the acute gout. This is a major. The second major criteria is the presence of the tophi, but this tophi is supported to be caused by monosodium urate crystal. You have to aspirate from the tophi, and you have to detect the presence of the monosodium urate also by polarized microscopy. This is enough for diagnosis. يبقى there are two major. One enough اللي هو monosodium urate crystal in the joint. It's enough for diagnosis. The presence of the tophi which supported to contain monosodium urate. It's enough for diagnosis. If this is not present, should be a 5 or more of the following minor criteria. There is a clinical and laboratory and X-ray. Clinical. First, there is involvement of the metatarsopharyngeal joint of the big toe. This is the most common, as we say. The presence of the tophi. This is a clinical. There is a redness of the joint. This is a clinical. There is a rapid progression of the disease within 1 day. This is a clinical. Acute inflammatory monoarthritis. This is a clinical. Okay. Like a laboratory, there is a hyperuricemia, and high serum uric acid level. This is a laboratory. And if you do a joint aspiration, there should not be a presence of bacterial infection. It does not contain a pus. And by examination by Gramstein or by culture, you should not, or there should not be any type of bacterial inflammation. Radiological, there is asymmetry of the involved joints by X-ray. This is the acute gout. We enter through the second types of arthritis, which is called oligoarthritis. Why it is called oligo? Because there is less than 3 joints are involved. Also it is called spondyloarthritis. Why it is called spondylo? Because the lumbar spine should be almost always involved. So it's called spondylo. Also it is called seronegative. Why it is seronegative? Because the rheumatoid factor is negative. It is either called mono because, it is called oligo because there is less than 3 joints are involved. It is called spondyloarthropathy because the lumbar spine should almost always be involved. It is called seronegative because the rheumatoid factor is negative. What's the type of this arthritis? It's either ankylosing spondylitis, or reactive arthritis, or enteropathic arthritis, or psoriatic arthritis. There are 4 types of seronegative arthritis or spondyloarthritis. How it is diagnosed? What's the criteria for diagnosis? They should be, we said it is called spondyloarthritis because the lumbar spine should almost always be involved. So the major criteria is the presence of the sacroiliitis, either clinically or by radiological involvement. This is a major. Plus 1 or more of the following spondyloarthropathic feature. What is the major criteria? Is sacroiliitis. The minor criteria, what's the minor criteria? The first is inflammatory low back pain. The second is the oligoarthritis. The third is enthesitis. What's enthesitis? It is an inflammation at the site of the insertion of the tendon to the bone. This is called the enthesis. Enthesitis. The first minor criteria is inflammatory low back pain. The second is the oligoarthritis. The third is enthesitis. The fourth is dactylitis. The fifth is acute interior uveitis. 6 is the psoriasis. 7 is a Crohn's disease or ulcerative colitis. 8 is the family history of seronegative arthritis. 9 is the response to non-steroid anti-inflammatory drug within 48 hours. 10 is the HLA-B27 positive. The last one is the positive or increasing CRB and ESR. This is a minor. We diagnose the presence of the spondyloarthropathy in the presence of one major, which is very important. What's this major? Is the sacroiliitis, either by imaging or clinically, plus one or more of the minor criteria. Type. This is the how to diagnose or criteria for diagnosis. What's the type? The first type is called ankylosing spondylitis. So, what is the definition of ankylosing? How to define ankylosing spondylitis? It is a chronic. Why it is chronic? Because it is more than 6 weeks duration. Duration more than 6, so it's chronic. Inflammatory. Why it is inflammatory? Because there is all cardinal symptom of inflammation is present. Oligo. Why it is oligoarthritis? Because there is less than 3 joints are involved. Oligoarthritis. It is asymmetrical. It involves the joint of the lower limb more than the joint of the upper limb. It involves the large joint more than the small joints. It's migratory in nature, and there is no deformity, and it is associated with enthesitis and with dactylitis. But this is the definition. Ankylosing spondylitis غالبا is presenting, or the most common presentation of ankylosing spondylitis is inflammatory low back pain. So, there is a back pain. The majority of the people will complain of the back pain. Yes, even a young or old patient, they complain of the back pain. The most important point when the patient come to you complaining of back pain is to differentiate whether it is inflammatory or mechanical. هل الباك بين is inflammatory or mechanical? So, is the back pain is inflammatory or mechanical? This is very important. The majority of the people have a mechanical. Some of them have trauma, some of them, the most common may be a spasm of the muscle of the spine. So you have to differentiate whether inflammatory or mechanical. How to differentiate? The patient with inflammatory low back pain will came to you complaining of. They said that I have a pain in the back. This pain is more common at night. It awoke me from sleep. It is associated with morning stiffness. When I am getting in the early morning, my back is very stiff. I cannot flex my back. It's more at night. It awoke me from the sleep. It's associated with prolonged morning stiffness, and it radiates to the buttock, either one side or both sides, and it is associated with limitation of the lumbar spine expansion in the frontal and in the sagittal plane. Also, if you do a test, it is called Schober test or modified Schober test, it is positive. This is an inflammatory low back pain. The majority of the patients with ankylosing spondylitis will come to you with inflammatory low back pain, about 70%. 30% will come to you just only with inflammatory oligoarthritis as described it before. Okay? What is the criteria for diagnosis of ankylosing spondylitis? They put 2 criteria, clinical and radiological criteria. The clinical criteria including there is inflammatory low back pain. And we said what is the characteristic of inflammatory low back pain and how to differentiate it from the mechanical. The first clinical is inflammatory low back pain. The second clinical criteria is limitation of the chest expansion. The third clinical criteria is limitation of lumbar spine movement in the frontal and in the sagittal plane. This is clinical. Radiological criteria, يا bilateral sacroiliitis grade 2 or more, أو unilateral sacroiliitis grade 3 or 4. Okay. So, what's the grade? How to diagnose an ankylosing spondylitis? There must be one of the radiological criteria, either bilateral or unilateral sacroiliitis, plus one or more of the clinical criteria. يبقى how to diagnose ankylosing مرة ثانية, they should be one radiological plus one or more clinical criteria. How to grade sacroiliitis? It's graded as the following. Grade 0 is normal. Grade 1 is suspicious. Grade 2 is mild. Grade 3 is moderate. Grade 4 is severe with ankylosis. Severe sacroiliitis with ankylosis. This is the ankylosing spondylitis. The second type of the seronegative arthritis is the reactive arthritis. Reactive arthritis لو جينا نعرفها برضه, it is a chronic because it's more than 6 weeks duration, inflammatory because all cardinal symptoms of inflammation are present, oligoarthritis because more than 3 joints are involved, the lower limb joints are involved more than the upper limb, the large joints are involved more than the small joint. It is asymmetrical and migratory, and there is no deformity, and it is associated with enthesitis and with dactylitis. Usually your patient has a history of dysentery or history of urethritis. He said to you that 1 day, up to 3 days, up to 6 weeks, I have a history of urethritis, or I have a history of dysentery. Either it's a bacillary dysentery, or اللي هو الأرسينيا انتيروكولاتيكا, أو urethritis, especially chlamydia urethritis. I have a urethral discharge if it is female. If it is male, I have a diarrhea with dysentery. There is a diarrhea with tenesmus. Dysentery means there is a bean during defecation. There is a tenesmus. Sometimes there is blood in the stool with mucus. يبقى عنده history of dysentery أو عنده history of urethritis with urethral discharge after a couple of 1 to 3 days or up to 6 weeks. He came to you complaining of chronic inflammatory oligoarthritis. The majority of the patients, some patients came to you complaining of inflammatory low back pain. Inflammatory low back pain. طبعا one of the variant of the reactive arthritis is called Reiter syndrome. Reiter syndrome has a characteristic 3 triad, which is arthritis, urethritis, and conjunctivitis. يبقى لو المريض عنده conjunctivitis مع arthritis مع urethritis, this is called Reiter syndrome. How to diagnose a reactive arthritis? There are 2 major. ايش هم 2 major criteria? They must be present. The first one is the presence of oligoarthritis, which is asymmetrical, lower limb more than the upper limb, large joint more than the small joint. Yes, it's migratory and it is اللي هو ايش associated with no deformity, or there is no deformity. Plus there is evidence of infection, whether my patient has a diarrhea before زي ما قلنا 1 or 3 days or even 6 weeks, or my patient have urethritis with urethral discharge. This is the 2 major. They must be present. لكن what's the minor criteria? The minor criteria يا أما there is a previous evidence of infection of the urethra or of the infection of the diarrhea. كيف previous? You have to do either a culture or you have to do اللي هو PCR to detect the causative organism. أو from the urethral discharge برضه you have to detect the presence of what? Of the chlamydia infection. طيب برضه they should be a persistent infection in the synovium. If you take a synovial fluid aspiration, you have to detect the presence of either chlamydial infection or other types of bacteria that cause reactive or that are responsible for reactive arthritis. So the active arthritis is diagnosed by the presence of two major criteria plus one of the previous evidence of infection of the urethra or infection of the enteritis, يعني infection of the intestine, أو there is persistence evidence of اللي هو infection in the synovium of the joint. This is the reactive. The third type is called psoriatic arthritis. Psoriatic arthritis, my patient has a past or family history or a present evidence of psoriasis in the skin. يبقى ممكن يقول لي my family there is a positive family history of psoriasis أو there is a past history of psoriasis يعني جالي psoriasis before a couple of times, or you detect the presence of psoriatic skin lesion during examination. يبقى this is a present plus what? Plus one of the following arthritic feature. يا أما inflammatory low back pain يا أما inflammatory oligoarthritis. So what's the character of the inflammatory oligoarthritis of the seronegative arthritis? I have to repeat it another time. It is chronic inflammatory oligoarthritis. Large joint more involved than the small joint. Lower limb are more involved than the upper limb. It is asymmetrical. It's migratory in nature and it is associated with no deformity, and usually there is associated dactylitis or enthesitis, inflammation of the tendon insertion to the bone. Type. قلنا the patient has one of the arthritic features, inflammatory low back pain or oligoarthritis or involvement of the distal interpharyngeal joint only, or chronic inflammatory polyarthritis that mimics تشابه rheumatoid arthritis except that there is negative rheumatoid factor and the subcutaneous nodule is absent. The last fourth type of arthritis is called arthritis mutilans. This is severe deforming arthritis. When you do an X-ray to the affected joint, it is called a pin in cup deformity. It's very severe deforming arthritis. So how to diagnose a psoriasis? Psoriasis is diagnosed by the presence of one major criteria plus three minor criteria. What's the major criteria? Is clinical or radiological evidence of the sacroiliac joint involvement. This is major. Clinical or radiological involvement of the sacroiliac joint. What's the minor criteria? The first minor criteria is the present, past or family history of psoriasis. This is one minor. يبقى يا أما psoriasis either present or past or family history. The second minor criteria is the nail changes. What's the nail changes in psoriasis? These are the following. What's the nail changes? أول nail changes is called pitting of the nail. Second nail changes is called onycholysis. The third nail changes is called hyperkeratosis. There is a transverse ridge. There is yellow discoloration of the nail margin. This is called the 5 nail changes in psoriasis. Okay? The first minor criteria is psoriatic lesion. The second minor is nail changes. The third minor is negative rheumatoid factor. The fourth minor criteria is the presence of dactylitis. The fifth minor criteria is the juxta-articular new bone formation by X-ray. To diagnose psoriasis, there should be one major, sacroiliitis, plus 3 minor criteria. This is the psoriasis. The fourth type of the seronegative arthritis, the enteropathic arthritis, the patient has a clinical or endoscopic evidence of اللي هو inflammatory bowel disease, ulcerative colitis or Crohn's disease, plus اللي هو يا اما inflammatory low back pain or اللي هو inflammatory oligoarthritis. This is the diagnosis of the enteropathic arthritis. We come to the last type of arthritis, is the polyarthritis. The first type of polyarthritis is the rheumatoid arthritis. How to define the rheumatoid arthritis? It's defined as the following. It's a chronic or acute. It's a chronic because it's more than 6 weeks duration. Inflammatory or mechanical. It is inflammatory because all cardinal symptoms of inflammation are present. Chronic inflammatory. Is it mono or oligo or poly? It is polyarthritis. Chronic inflammatory polyarthritis. Is it symmetrical and bilateral? Yes, symmetrical and bilateral. It involves the upper limb more than the lower limb joint. It involves the small joint more than the large joints. It is constant in nature and it has a characteristic deformity, and usually there is involvement of the cervical spine, while the lumbar spine is not involved. يبقى لو مسكت الروماتيد تمسك ايش؟ cervical spine, but the lumbar spine is not involved. If the lumbar spine is involved, you have to think of seronegative arthritis. Okay? يبقى it's a chronic inflammatory polyarthritis, bilateral and symmetrical, upper limb more than the lower limb, small joint more than the large joint. It is constant in nature and it is associated with characteristic deformity, and the cervical spine is involved while the lumbar spine is not involved. Okay? This is the definition. Like, and they put a criteria for diagnosis of rheumatoid arthritis. This is the new criteria. The first one is the number of the joint involved. If just only one large joint, you have to give a 0 point. Large joint, it involves mainly the small joint. So if one large joint are involved, 0 point. If 2 to 10 large joint is involved, just only 1 point. Like in the small joint is more important. 1 to 3 small joint is 2 point. 4 to 10 small joint is 3 points. More than 10 joint is small and large 5 point. one large joint قلنا ايش؟ 0 point. 2 to 10 large joint just only 1 point. 1 to 3 small joint 2 point. 4 to 10 small joint 3 points. More than 10 joint large and small يبقى 5 points. The second is اللي هو الimmunological. Immunological you have to measure rheumatoid factors and anti-CCB, anti-cyclic citrullineated protein. If it is negative يبقى 0 points. If it is low titer يبقى 2 points. It's high titer يبقى كم؟ 3 points. يبقى negative 0, low titer 2 points, high titer 3 points. نيجي اللي هو CRB والإيسار. Negative CRB and إيسار 0 points, positive يبقى 1 point. آخر نقطة اللي duration of the disease. If it is less than 6 weeks duration 0 point, more than 6 weeks duration 1 point. You have to diagnose rheumatoid arthritis in the presence of 6 points of these criteria. Okay, 6 points. The second type, which is very important disease, systemic lupus erythematosus. طيب, when to suspect a systemic lupus يقولوا عبارة حلوة جميلة كده. If a female gender during a childbearing period he came to you complaining of fever, arthralgia and rash. This is 3 triad. Fever, arthralgia and rash. You have to rule out the presence of systemic lupus erythematosus. But they put a criteria for diagnosis of lupus. طبعا للاختصار عملوا حاجة اسمها SOB brain MD. SOB brain MD. S is a serocytes. Serocytes. Well, the first criteria, serocytes. What is serocytes? It's either a pericarditis. It's detected either clinically or by ECG or echocardiography. مش شرط clinically or laboratory. Pleurisy يبقى clinical pleuritic bean أو peritonitis يبقى there is a bean in the abdomen. يبقى this is oral ulcers. But the oral ulcer has a certain character. First, it should be painless, not painful. So when it is painless, it is detected by the physician or by the patient? By the doctor, not by the patient. It's painless. And it fixes the soft palate. And it is usually lasts just only for 2 to 3 days and disappear. Then it recurs. There is recurrence oral ulcer. This is the O. The third is the A, anti-nuclear antibody, ANA. The anti-nuclear antibody is very important in the diagnosis of systemic lupus erythematosus. And some say that if you have a two negative successive result of anti-nuclear antibody, this is rule out as systemic lupus erythematosus. يبقى عشان كده حطه لوحده A. البي is a photosensitivity. Photosensitivity, your patient said that when I am exposed to sun, I have skin rashes, which is pruritic. This skin rashes occurs in the sun exposed area, particularly between the distal and the proximal interpharyngeal joint. The photosensitivity. B is the blood test. You might have a pancytopenia, or just one of the elements of the blood are affected. Lymphocytopenia, leukopenia, or thrombocytopenia, or all of them يبقى pancytopenia. R, renal involvement. This is the most common affected joint and the most common serious joint to be involved. It may be the cause of death in a patient with lupus. Renal nephritis. The renal nephritis is diagnosed by proteinuria more than 0.5 gram per day. More 0.5 gram per day. Yani 24-hour urine collection of protein if you find more than 0.5 gram per day of protein. Or hematuria. But the hematuria is called microscopic. What's the definition of microscopic hematuria? The presence of the more than 5 red blood cell bear higher field microscopy in the first voided urine sample. يبقى أكثر من 5 blood cell bear high power field microscopy in the first voided urine sample. يبقى this is the renal. Arthritis. But arthritis is entering in the criteria for diagnosis of systemic lupus, not arthralgia. The patient must have arthritis. What's the difference between the two? Arthralgia just a pain in the joint. Like an arthritis, pain and swelling and inflammation of the joint. It is symmetrical arthritis as we said before. This is criteria. I, immunological test. What's the immunological test? Anti double strand, anti SM antibody, anti histone antibody. This is in the drug induced lupus. If you think of the drug induced lupus, anti double strand is negative. So you have to do anti histone antibody. الكرايتيريا اللي بعد اللي neurological criteria. This is in the form of psychosis or seizure in the absence of any other اللي هو explained cause. يعني you have to rule اللي هو other causes of psychosis in the absence of other explained cause for psychosis. MD. What is the M? M is the malar rash. Malar rash. What is the malar rash? As we said, there is a rash that involving the nose and the cheeks, but it's bare the nasolabial fold. If the nasolabial fold are involved, you have to think of dermatomyositis. يبقى in lupus, the nasolabial fold is spared. The last one is called discoid lupus. Discoid lupus. How to diagnose a systemic lupus? By the presence of 4 out of 11 criteria as we explain. SOB, brain, MD. Okay. What's the other? The last one maybe is the scleroderma. What's a scleroderma? Scleroderma is a thickening and tightness and induration of the skin. If you look to the skin of any person, you can find a skin wrinkles, yes? You can find a dilated vein, yes? You can make a skin fold, huh? You can make a skin fold. But if the patient have a scleroderma, thickening and tightness of the skin, so the creases will disappear and the dilated vein will disappear and you cannot make a skin fold. If you found this, the patient has a scleroderma, thickening and tightness and induration of the skin. It's classified into 2 types, localized and generalized scleroderma, according to the distribution of thickness and induration of the skin. If it is only involved the fingers and the hand, this is localized. Sometimes it's called crest syndrome. What's the crest? What is the C? C is calcinosis, R is rhinoid phenomena, E is esophageal involvement, crest ES اللي هو sclerodactyly. What's a sclerodactyly? It is thickening and tightness and induration of the skin of the finger only. And T is telangiectasia. This is the crest syndrome. لكن generalized scleroderma, it involves there is a thickening, tightness and duration of the skin that extend from the proximal interpharyngeal joint to involve the whole hands and head and neck and even the chest. So this is called generalized scleroderma. How to diagnose scleroderma? By one major criteria is scleroderma. المريض عنده thickness و tightness and duration of the skin that extends from the proximal interpharyngeal joint to involve الhands والupper limb والhead والneck والchest. Or 2 minor criteria. one major اللي هو scleroderma أو 2 minor. إيش هم minor criteria? The first minor is sclerodactyly. What's sclerodactyly? It is a thickness, tightness, and duration of the skin of the finger only. This is called sclerodactyly. دي واحدة. This is one minor. The second minor is a nail biting. Nail biting. The third minor is the fibrosis at the basis of the lung. يبقى scleroderma is diagnosed by the presence of one major scleroderma or 2 minor. What's the minor criteria? The first one is called sclerodactyly. The second one is called biting of the nail. The third one is called bilateral basal lung fibrosis. والسلام عليكم ورحمة الله وبركاته.